So we are still catching up with the time, and the next session is Kanya Conference with Wheels Foundation. Before that, there is a small presentation by Meenakshi. So you have the presentation ready, please? That is what you... No. You are ready with your presentation? You said she will present?
That's a video from Kanya conference. They're going to show the video first and then they will have
Yeah.
the presentation.
So please show. Uh, 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 when is your presentation, madam? You were downloading. No, what is the time? Is it in Kanya conference? Yeah.
What we have Kanya conference is the panel discussion.
Yeah. So I think I'll hand over to Dr. Samuel to run the show. He'll take care of that.
Good afternoon and welcome. My name is Dr. Sumul Rawal. I'm a secretary of the API, and we have very interesting, much needed session at this time. And I want to thank everybody to be here today. We have a session called Kanya Conference. We have invited about 12 panelists from the country, and they are from well-known, respected institutions, IIT and some other major institutions, has done so much work for the underprivileged women and some other projects in a country. So at this time, I want to just, because we have many panelists here, they will have a few minutes to say about what they are doing and then they are planning to do. And before we start, we have 5 minutes of video that we're going to watch, and then I'm going to invite panelists one by one, who I hope whoever is here. So at this time, we will play the video first, and then we'll start our panel discussion one by one.
Greetings from the incredibly loved city of Philadelphia. I'm Dr. Rajka, cardiologist. I'm a founding member of API and lifetime member since 1982. Also, board member and chairman of the Health Council of Wills Global Foundation. Your help is needed, particularly for the rural community. The mission of Wills Global Foundation is to use technology-enabled solutions. National hygiene working, and we have created our NOVA. So we have undertaken this and find our healthcare experts with technocrats. There are so many things we can sanitize to solve the problems and give it back to our country. This problem of medical hygiene has perceived by young doctor in the making and people of Ghana. She did something, and the help of technocrats, he has begun solving this problem. It's a pleasure to bring relief to this studies in her owners. Thank you very much for this opportunity. This is the first time I believe technocrats and doctors and healthcare providers are coming together on the same platform, and this will go in all ways without many of the problems. Thank you so much.
Good afternoon, everyone. My name is Ricky Cronin, and in 2013, I worked with Wheels to launch the Kenya project. Imagine being a young girl excited about learning, but suddenly finding yourself unable to attend school because of something as natural as menstruation. This is the reality for many girls in various parts of India, and this was the reality I personally witnessed when I went to visit Ghana in 2013. As I walked through the local school, I noticed a concerning pattern. The number of girls in school significantly decreased as they grew older. In conversations, the girls shared their struggles openly. They spoke of missing school days each month due to the lack of proper sanitation facilities and menstrual products available at school. Some even shared stories of the societal stigmas that made them feel ashamed and unworthy. To avoid the harsh realities they faced in school, most girls found it easier to give up on education entirely and drop out. The repercussions of this issue have become devastating and obvious. A halt to education, a perpetuated cycle of inequality, and shattered dreams for the future. After my initial visit, I set out to make a tangible difference in the lives of these young girls. With the Wheels team, we established a sanitary napkin making factory with a singular goal: to provide affordable and high-quality sanitary pads to the local community, while supplying free pads to local schoolgirls. This factory stood not only as a production unit, but as a beacon of hope, advocating for the fundamental right of every girl to access an education. As the factory started, we realized that the stigma around menstruation is stronger than we ever could have imagined. Simply giving access to menstrual hygiene products is not enough to bring these girls back to school. Instead, we have to break the silence surrounding menstruation, creating an environment where girls feel supported and empowered to continue their education. Now, as a third-year medical student myself, I recognize that it's not only about menstrual products. It's about empowering girls to attend school confidently and unlock their full potential. Together, let's break the barriers, ensure access to education, and create a healthier, brighter future for these young girls.
On behalf of your partner AIIMS Global Foundation, warm greetings and good afternoon. Friends, building upon inspiring and remarkable work of young Priti 5 years ago, last year AIIMS embraced a very compelling solution from our partner Nova GSR, which for the first time brought out quality and affordable pads at rupees 2, available 24 hours through a purpose-designed self-service dispenser. With that solution already scaling to now 800 rural communities in Bihar and Jharkhand, AIIMS is partnering with several social entrepreneurs, IITs, and API to shift into the next key chapter: acceleration of environmental-friendly solutions with self-reliance for India. Thanks, and welcome to this exciting panel discussion.
On behalf of API, I want to thank all the guests traveling to attend the session from the Will Foundation, Will Global Foundation. Is Dr. Samadar here? She just stepped out. Okay. So we have multiple panelists here. I just don't know how many panelists are here. So I want to just mention the names so that way I know how many panelists are here, so then we can have them have a brief comments. Professor Satish Agnihotri, great. Professor Virendra Kumar, great. Professor Vivek Kumar is not here. Okay. Professor Kanan Mugdalia. Okay, great. Professor Dr. Meenakshi Bharat, I see here. Dr. Sang Desai. Okay, great. Dr. Yogesh Andale. Okay. Anita Tampi. Okay, great. Jaideep Mandal. Kishan Goenka. So let's just do one by one, and whoever is here, we will have. And I think you guys all have a few minutes to say, and then we will have question and answer for a few more minutes at the end. So I will start with Dr. Meenakshi is here. We'll start with her presentation. That's okay.
Thank you very much for giving me this opportunity to speak. I'm basically a gynecologist of 35 years experience, but over the last 10, 12 years, I've been concentrating on spreading the message of sustainable menstrual products, which can make periods a happy periods. Now, this is not only for the rural group, it is for every woman across the world, We all need happy periods. We all need comfortable periods. And the 21st century products are two. One, an old product, cloth pads with a new design, and the other one is the menstrual cup, which completely transforms our life from age 20 to age 50. Over 30 years, we can use 3 menstrual cups and it can reduce the garbage completely. On a normal basis, if we use disposable sanitary napkins, whatever the quality and this thing, it produces garbage, and that garbage will never go away. So therefore, we are asking the young girls from menarche to 18 to 20 years to use cloth pads with a backing at the back which gives it leak-proof abilities, and this can be stitched locally in every village, in every district, so that they are not dependent on any factory to make it happen. So this is a fabulous design wherein the local tailor stitches, the handloom industry gives the cloth, and the young girl gets the pad which she can wash, hang it out in the sun, and completely infection free. So this can last 3 to 4 years for every girl, and if she has 3 sets of it, 3 into 5, it'll take her till she reaches 18 years of age. The menstrual cup is something that is fantastic. 1 cup made of medical grade silicone, and all of you doctors know that medical grade silicone has transformed the whole system of instrumentation. So this medical grade silicone is the cup which was invented in 1937 by an American actress. Then it was rubber and not comfortable to use. But over the last 10 years, medical grade silicone has become very pliable, very easy to use. And unfortunately, people like me who had attained menopause before this came into being have not had the advantage of this. But all the younger people who are fortunate to be menstruating need to use this menstrual cup, which can hold the equivalent of blood of 3 pads. So 1 cup can last about 8 to 12 hours, and so you are really period free. You don't need to reach menopause to be comfortable without feeling the wetness of the periods. Just use the menstrual cup and you can have a fabulous period. You can do everything that you want. No rash, no itching, nothing. So menstrual cup is the way forward for periods for everybody across the world. 1.9 billion menstruators are there, and we need to provide them with this cup. The cup is very cheap. A cup in the US will cost you $30, which will last 10 years, which is equivalent to $3 a year. The same way, this cup in India costs about 250 rupees, and divided by 10 years, it's 2.5 rupees per year. So nothing can be cheaper than the menstrual cup that we can give. There is a learning curve for everything. ABCD has a learning curve. This has a small learning curve. And for women who are married, inserting a menstrual cup is just very simple because they're comfortable with intercourse. The mother learns to use the cup. She will then guide the young child, not necessarily young, a 16 and 18-year-old, to use the cup, and she will forever have happy periods. So I think that we need to change the philosophy of providing disposable sanitary napkins to the poor for less amount of money. I think each one of us women deserve to have happy periods without it being compromised with the price. The menstrual cup and the cloth pad is the best way forward. And I have, over the last 10 years, been propagating this, and women have taken it up in large numbers. Large numbers means 20, 30, 40, 50,000 we have done, and they are very happy with the outcome. Takes about 6 months to get over the fear of putting this cup inside. But once they have used it, it's like Amitabh Bachchan says, "Pehle istemal karo, फिर विश्वास करो. अगर आप इस्तेमाल नहीं करेंगे तो विश्वास का सवाल ही नहीं है. So please give them the opportunity everywhere across the world to use the menstrual cup for women who are sexually active, who are 18 plus, and who are married. It makes a difference. Thank you very much for the opportunity. I hope I have inspired you all to take this menstrual cup up. Doctors have to understand what it is, because you will get the girl or the woman to come to you and say, can I use it? And if you turn around and say, no, don't use it because it will produce prolapse of the uterus, then you're doing a great disservice. Prolapse only happens after age 60. It doesn't happen when you're menstruating. So thank you very much for this opportunity.
Thank you, Dr. Meenakshi. That was kind of very useful information. So all the panelists not going to talk. I'm going to mention the panelist who will be coming here and give a talk about 5 minutes each. So our next two panelists, Jaideep and Anita, will cover their discussion in next 5 minutes. So can I have those two panelists here?
Respected co-panelists, esteemed members of the audience, good afternoon to you all. My name is Anita Tampi. I'm Director Technical and Operations of HLL Lifecare Limited. It's a Government of India company under the Ministry of Health and Family Welfare. I'll briefly speak on the menstrual cup projects which we have been doing. I'll stick to the time slot. As a person, as an engineer, I've been making billions and billions of condoms after I finish my graduation, because HLL, as part of HLL, HLL started making male contraceptive condoms in the country. So mid-career, I joined, our professor is here, I joined Sitara at IIT Bombay and did my MTech on technology and development, which fundamentally changed my perspective on technology and the choice of technology, the need to disseminate the technology, appropriate technology to take such products to the people who are needy. And later on, that motivated the work on menstrual cup in a way, and I'm here today. And Wheels Global Foundation also has taken a very keen interest in the work we are doing. So I'll briefly tell the story of our project. What happened is, you must all be knowing that in 2018, there was a flood in Kerala. It was very disastrous. And my company makes incinerators. So I went to the relief camps to distribute or donate the these incinerators, napkin incinerators. And then, I was shocked to see the magnitude of the issue of disposal of used sanitary napkins, because relief materials contained huge quantity of, everybody was sending in napkins, but there was no way to dispose it in the waterlogged areas. And then, we suggested, why don't you try, we suggested the district administration and the people, the municipality, why don't you try menstrual cups? And Satish Agnihotri sir, professor from Sitara, he came with 1,000 arms to support this and secured funds from Coal India Limited, and we tried it. They agreed, the people agreed, because it was such a necessity. This is very important, because they were not because they were very much convinced, they had their questions, doubts, but because it was such a necessity, it happened. And then, we ourselves were surprised. We had an acceptability of 91.5%. 91 it surprised us. Then we started replicating the project in different areas, and now we are touching 500,000 all over India, in Jharkhand, in Kerala. In Kerala, government has come up with they have given budget allocation, perhaps first of its kind in the world for a government to do, and a circular stating that 100% coverage over all LSGBs, which is being done. Then Tamil Nadu, Karnataka, Jharkhand, all these places we have been, Maharashtra, doing. And So that is where we are now. We are making M cups with an injection molding machine using liquid silicone rubber. I'm not going to the technology part of it. And the model, I'll tell you what's our model. What we do is, this is a model which we have developed and perfected over a period of time, learning from the ground. More about sir's involvement and how take it forward, Sadhya Shaktihote sir will talk when his turn comes. A team of public health professionals go to a particular locality, understand the specificities of the locality first. Then they communicate, this is very important, then they communicate with the district administration, the district magistrate, the medical people involved in the area, the self-help groups, the NGOs, all key stakeholders. Once everyone is in the same page, they start sessions. They start sessions to speak to the people, to the beneficiaries, and then distribute the product. And the focus is on awareness generation on the structure and function of one's body and on the product and its use, not just on the product and its use. Because doctor was telling the other day, we also have experience. People, even grown-up people, even people who have delivered 1 or 2 babies, they are afraid whether this will be lost inside their womb. They don't know what's the structure of their own body. So we focus on that. Then we do the follow-up sessions. After 2 cycles, we run a 24/7 call center support system, and then an impact study is done after 6 cycles. And the key learning from the projects, we have 87 to 92% acceptability. Interestingly, if we give it without any awareness session, just distribute, 20% of the people use it. And if we give it with an awareness session, 80% of the people use it, and up to 92% continue using it. So that was really a very good learning. And now the benefits. This I will briefly, the figures I will tell, taking off from what Madam was telling. It's the product made of medical grade silicone rubber, we all know, and it's reusable up to 10 years, and it definitely demands attention. Okay, in addition to the safety, privacy, and ease of use, it has been estimated that 1 M cup for a use period of just 5 years equals 720 parts. This is a very conservative calculation. It means against a weight of M cup can weigh, say, 45 grams average. On an average, if it weighs 45 grams, the weight of 720 napkins add up to 7.2 kilograms, which means even a modest number of 10,000 M cups can divert a sanitary napkin waste of 200 tons in 5 years. Can you believe it? 200 tons in 5 years, just 10,000. And the corresponding carbon footprint reduction is 253 tons of carbon dioxide equivalent. And there is a saving against napkin purchase, which is a recurring cost, some 20 lakhs. This is against 10,000 pieces. And that's it. And there is one issue. In India, it's not regulated yet. The Bureau of Indian Standards is still working on regulations, and what we are doing is that we are putting together UNFPA guidelines, the FDA specifications, and the EU specifications, and we have come up with a spec of our own, and that's how we work. And now I'm concluding. There is enough evidence in literature in favor of safety, efficacy, and the advantages of M cup. What is required is that we need to create knowledge, because there is dearth in knowledge, data, information, conduct studies, and there has to be lots of discourses around this product, which is very important. And that's how, and the government of India is now considering including this product in its procurement. So the future, this is a game changer product. Could have it not only changes as long-term impact on the dignity of women and their life as individuals, and also it has environmental impact. huge. Thank you very much.
Thank you so much. And I'll have our next panelist here.
Hi, good evening. Thank you, RP and Wills Foundation for this opportunity. I'm founder of Akar Innovations. We have been working in menstrual hygiene for the last 14 years. And our work is primarily into two areas. One is the education awareness around menstrual hygiene and also making compostable sanitary pads. Can you, next slide, please? Just skip the machines and all. Next slide, please. Sorry. Yeah, so I think this problem has already been addressed. I'm not getting into the details of it. So right, currently we have about 360 odd millions of women who are in menstruating age in India. And out of that, only about 35 to 40% women who use sanitary pads or any other products per se. There's a huge a number of women who are not using anything. And that the primary reason is actually the awareness is not there. So beyond any products per se, whatever solution we may provide, the main effort should be put in towards the awareness generation around menstrual hygiene so that the women and girls and the menstruators, so they get to know why it is important to put in effort to menstruation. That is, like during our sessions, we have seen a lot of men in India, they wanted to have kids, but then they don't know the menstruation and childbirth has a connection. As simple as that thing. Like once you make that simple connection, that makes a lot of difference. And then the men in the families try in supporting the females in the families by either buying any products or supporting within the family, within the community per se. Next slide, please. So just next. Yeah. So what we introduced into India and also into the world was the compostable pad, first time in India and also the globe in 2012-13, when this was not been a discussion point anywhere in the world. So what it is, how it is different than any normal sanitary pads there in the market. The very first thing what we bring in is the health aspect. So the commercial pads have something called super absorbent polymer, which is a sodium polyacrylate, something which is harmful for like it can create irritations and all. I think as all of you are mostly doctors, you would know that in fact the diapers that causes rashes, the major reason behind the rashes is actually the super absorbent, which is used in diapers. Same thing happens in the for sanitary pads also, and there are other reasons also. One of the primary reason is this super absorbent. So we had changed that, replaced with a natural super absorbent, which is made out of plant cellulose, and which satisfy basically the health standards. I'm part of the Bureau of Indian Standard Committee for sanitary pads also in India, and therein, like, we've also introduced something called cytotoxicity standard, which proves that your product is safe for human use. So our products have tested for that. So that's how we're different in terms of health aspect than any other products in the market right now in sanitary pads category. Secondly, we're also first one to introduce the compostable pads. What does it mean? Actually, it means that once it has been used, once you throw it, it can get composted within 90 to 180 days in composting conditions. If it is the conditions are not there, it will take a little longer, but it will ultimately get composted and becomes manure and part of the soil, which can be used for plantations also. We don't recommend it for use for fruits and all because bloods may have certain things like which may not be helpful, but for any other plantation it can be used. And whatever we say, it's just not about like only what we say. We have certifications to back up, and also we have crossed more than 1 million consumers till date over the last 10 years in villages. We started working primarily in villages of India. We worked about 15 states, and then also we have taken our solutions to Africa, about 8-9 countries, wherein we are implementing this through many NGOs and government were supported by US and UK funders. So yeah, so that's about the product. You can go next, please. We have various range of products, like so. Next one. So the cheapest one what we introduced was the Eco Plus pads, which is like this, and this is sold at 50 cents per packet for our 8 pads. And so this was there 50 cents about 6 years back, what we were selling, and now also we sell it at the same price. We have done our own R&D and innovations to keep the price low and then make it same, and it is affordable for the mass consumers. And which is, although it's a compostable pad, also it's a healthier pad, but still the price is lower than many multinational pads available in the market. And this we distribute on our own. From the sales we do it in the Amazon and commercial market. A portion of the money goes for giving away free pads and education, menstrual hygiene education in the villages. We have been doing it for almost 20-30,000 girls every month from our sources, and also we get funded by other CSR organizations wherein we get the support and then donate and distribute these pads along with education, because we believe education is most important even if beyond the giving pads. Next, please. This I already talked about. I think we'll skip that. Next, please. Yeah, so I talked about it briefly. Like, so whatever we say, we have a backup. Like, we have ISO certification for compostability. We have also biocompatibility certifications as per the ISO standards, and also we follow the BIS standard of Government of India, obviously. Next, please. This also we skip this. Next. The other work what we have also done was introducing indigenous materials into sanitary pads. Like, primarily the sanitary pads and diapers are made from pine wood pulp, which come from US and Canada only. And we have replaced that with the natural superabsorbent available in India and also in African countries, which are cheaper and also available in the local places, plenty in India. We are about to introduce the commercial pads made out of these materials very soon in the commercial market. As of now, we have been using the wood pulp only, but then very soon we're going to replace that in the commercial market. We already done testings for the same. Just go to the next slide, sorry. Just next. Yeah, this, I think briefly I've spoken earlier, but then so every sanitary pad, when it become a compost, it creates about 40 to 50 grams of manure instead of the toxic like waste, which otherwise creates, which a previous speaker also talked about, which is like from plastic pads. Either if you burn it, it releases toxic gases, which can also cause cancer. If it also goes to the soil, it remains in the soil for more than 500 years and obviously create a lot of challenges. If we compare with the compostable pads, we generate compost instead of plastic waste or like fumes, and then we also reduce the carbon emission by almost 0.5 grams per pad. And then our target, and then we are also saving, like, while disposing of the pads. Yes. So, while the commercial pads are being waste management is done by the government. They spend about 3 to 5 rupees per pad many cases, wherein like when you use a compostable pads, it converts into compost, which can be also sold as a manure in other ways. And we have a target to reach about 1 million, reduce 1 million tons of this toxic waste in next 3 years. That's our plan. Couple more slides are there. This next. Yeah, so as I mentioned earlier, we have crossed 1 million consumers till date over last 10 years. We have also done our awareness program through Akar Social Ventures through about 400,000 plus girls. And we are working about 9 countries in Africa and also in Nepal and in India. So, and we cover actually 12 Sustainable Development Goals of United Nations through our work. I'll just stop here and I'll invite, like, have any questions. I think this is running short of time, but then happy to answer any queries in later date. Thank you. Sure, thank you.
So with the interest of time, I request all the panelists, please keep your talk to the 5 minutes. Next panelist is Professor Vivek. Can I have you here at the podium? You want to have the 5 minutes talk? He's not here, okay. And Dr. Meenakshi has talked already. Professor Satish? Professor Satish is not here? Oh, okay. Is a part of the whole thing?
Don't worry, I will not take 5 minutes.
Okay. Okay. And then one more after that, and we'll have a panel discussion and question answer.
Hi, thank you very much for this opportunity. My name is Satish Agnihotri. I teach at IIT Bombay. But before that, I happened to be in bureaucracy. I retired as Secretary Coordination in Cabinet Secretariat and then joined IIT Bombay, which is my alma mater. My entry into this entire area came because we are holding 2 solid waste management workshops. And we noticed that there's an elephant in the room called menstrual waste. No one talks about it. So I talked to my colleague and I said, let us have a thematic workshop on menstrual waste handling. A lot of eyebrows were raised in IIT saying, IIT mein kyon? Our simple response was, IIT mein kyon nahi? And when we did these 2 workshops, in the first workshop, there was a technical keynote address by a NEERI scientist, and which opened everybody's eyes, that if we stick to sanitary pad plus incineration combination, our demographic dividend is going to become a demographic nightmare. Number two, if you incinerate below 800 degrees, you are creating more problem than you can solve, because you are putting even carcinogenic compounds in the air. So what is the solution? Either go for reusables, which doesn't have a great history of catching up, or go for menstrual cup. And which is where, as Anita mentioned, the Kerala floods came in handy. I was on the CIL board, so we gave CSR support. Then Air India Express came and gave support. There's a very simple trick which I suggest to Anita. When you are talking to a male CEO, say first advantage is carbon footprint reduction. Second is dignity of the dignity of the Safai Karmachari. Third, by the way, is women's menstrual health. But if there is a woman CEO who is giving CSR support, you reverse the sequence. उनको बोलो मैम पहला advantage women's health का है, दूसरा dignity of the worker, and तीसरा carbon footprint. And Anita will vouch that this technique has worked. So I will also suggest that you take either of the sequence, but as medical practitioners, please propagate the menstrual health. I think on the policy side, it's time that just as we keep talking of the unmet need of contraception, I think for women, it's time that we talk of unmet need of good menstrual health product for women. In my own backdoor channel discussions, I've been persuading Ministry of Health to take this up. And let me mention this, that when Kerala Finance Minister first time saw this, he was surprised. He says, Coal India CSR support दे रहा है केरला को, पहला surprise. Silicon cups में दे रहा है, दूसरा surprise. So then he came up with support from the Kerala Finance Ministry. So I think now many other governments are on it, and we are persuading the NHM. My last request is, can we push this as a product which consumer buys rather than going the subsidy route? So this is our next endeavor कि इसमें subsidy वगैरह की ज़रूरत नहीं है. Dr. Bharat already gave you the calculation. एक साल में ₹2.5 is not a big deal. So I think our next port of call will be from 500,000. One has to jump, a much larger segment of the market, where the help of professionals like yours and foundations like Win Foundation will be very helpful. Thank you very much.
Thank you, sir, for your kind and brief remarks. At this point, I would invite the final panelist who would conclude, Mr. Sang Desai, who will conclude with his final remarks, and then we will open the floor for questions and answers. So, Mr. Desai.
Thanks. So after all the panelists, I am here who is not an expert in this area. So you'll be not talking specifically. But I come here as chairman of WILS in India. So I'll just spend few seconds, in fact, explaining WILS. WILS is an association of IIT graduates, and now also in medical field who are not necessarily IIT graduates. Together we are based as a headquarter in US. WILS stands for Water, Health, H, L is for livelihood, E for energy, E for education, and S for sustainability. So we work in all these areas, but we have councils for each of these, WHLEES, and Health Council, which is Dr. Raj Shah talked about, who is also a founder member of API. He is part of our WILS board in US, and he is driving WILS Council. So within WILS Council, Health Council, sorry, we have this menstrual project that we are supporting along with API, and that's why I'm here. So I'm very excited that now we have a partnership with API. Thanks to API and thanks to Raja and others who are involved in both the sides. I'll quickly tell you what we are presently doing in WILS for supporting menstrual health. We have an association with an organization called NOBA. NOBA is a Bihar headquartered organization. They are supporting our mission in this area, and they are kind of working with 700 rural communities in India around Bihar and Jharkhand. And we have very low cost, very affordable sanitary pads, which is at ₹2, and they are made easy to access via innovative self-service dispenser. And this is being done, as I said, in 700 rural communities. Now, to take this ahead, we wanted to move beyond these two states. So we have now gone to West Bengal with our NGO partner there called Micro. So Micro and Wheels again will work in this area. Our ultimate aim actually is to impact almost 20% of India's rural community as a larger vision in all the areas. So health becomes part of that, and menstrual health becomes part of subset of it. So what we are embarking really upon is a much larger mission. This is the first small step that we are taking. So we request all of you API officers and API members to support us in this movement, because we are not talking of something which is small project, but a scalable project at a national level is what we are looking at. And to make that happen, we are going all out, as you saw, to have association with NGOs, associations with API, of course, and many government support that we need. What happens is many of the IIT graduates today are also, IAS officers, including my friend Satish, who just spoke. And some of them obviously are very supportive. So we have a reach and also an influence at a national level. So if API can really work with us, it will be a great service to the nation. What I'm going to now do is to announce something important. Can we put that? This one, yeah. So we want to have something to have this commitment to this thing, menstrual hygiene. Here is something that we are announcing jointly with API and Wheels, is an award of $10,000 together by API and Wheels. Can you scroll? There is a description of that. I'll able to read it out for all of you. Otherwise, I'll read from here, but it's not there. Okay, so basically what we are saying is, this whole issue is to recognize the pressing need to address menstrual health challenges and empower women and girls. We proudly announce this $10,000 support for fostering innovation in the menstrual hygiene management. This pledge signifies our dedication to fostering positive change, breaking taboos, and promoting access to the improved menstrual hygiene solutions. We believe in the power of innovation to create lasting impact, and through this collaboration, we aim to contribute to the healthier and more dignified future for women and girls across the India. So may this donation serve as a catalyst for groundbreaking projects. Now, how it is going to work is as follows. What we are doing is, basically, we are announcing it today here, along with API, as I said. So this award fund will be used to accelerate affordable and access, which is when achieved gets us national scale level penetration. So national level scale is what we are asking for getting this award. It will be given to the entity submitting the best plan using the funds to achieve material acceleration of affordability and access of an environment-friendly imports avoiding solution, and we are asking for a deadline of 31st March 2024. So actually I can even project this, but maybe it's too late now. Basically, I'm repeating again. It will be given to the entity submitting the best plan using the funds to achieve material acceleration of affordability and access, both affordability and access of an environment-friendly, important, import avoiding solution. So anybody who presents this plan, which is accessible, distributable, and low cost and environment friendly, then Wheels and API team will have a joint panel of experts to select the winning entity for announcement of appropriate forum. We'll announce where it will be actually given to the people and all that. So today we are signing this agreement with API. So on behalf of Wheels, I would like to thank API for giving us this opportunity and looking forward to a great collaboration. Thank you.
Thank you, Mr. Desai. That was also very kind, and I think we're excited to part of with the Wheel Global. They do amazing job all over the world, and we definitely want to be part of this innovative efforts that they are doing. The last 5 minutes, Professor Virendra Kumar Vijay is going to say a few words, and then we'll have a panel.
Yeah, kindly on the lights. Yeah, I am Virendra Kumar Vijay, teaching at Center for Rural Development Technology, IIT Delhi, and also coordinating a program of Government of India, Ministry of Education, Unnat Bharat Abhiyan. So in Unnat Bharat Abhiyan, what we are doing is that we are requesting all higher educational institutions, means all colleges in the country, to adopt a cluster of 5 villages around them, and utilizing their students and faculty members, try and develop these villages and in collaboration with the district administration. तो अभी तक हम लोग की कोशिश है, 2014 में जब भारत में सरकार बनी तो हमने ये आइडिया दिया, उस आइडिया को मिनिस्ट्री ने स्वीकार किया और उन्नत भारत अभियान पिछले 9 साल से चल रहा है. अभी हम लगभग वी आर working with nearly 3,600 universities and colleges, which includes all IITs, all NITs, all ICERs, all AIIMS, all central institutes, state universities and colleges, working with nearly 18,000 villages. तो अभी प्रधानमंत्री जी ने कहा कि नहीं भैया जी, तो देश बहुत बड़ा है, 7 लाख गांव हैं, 50,000 कॉलेजेस हैं, तो दिस शुड रीच आउट टू एवरीवन. इन अमृतकाल व्हाट ही सेंट ए मैसेज टू मी, आत्मा गांव की, सुविधा शहर की. If India has to become a developed country by 2047, means अमृतकाल, तो उसमें खाली गांव, खाली शहर का डेवलपमेंट से नहीं होगा, खाली इकोनॉमिक डेवलपमेंट से नहीं होगा. जब ही रेज 2 इश्यूज कि गांव का डेवलपमेंट हो, गांव सेल्फ रिलायंट बने और साथ में एजुकेशन सिस्टम हमारा ठीक हो, तो इन दोनों को मर्ज करके उन्नत भारत अभियान कार्यक्रम चल रहा है. और हम लोग कोशिश करेंगे कि आने वाले 10 साल में पूरे देश भर की 50,000 कॉलेजेस, लगभग 7 लाख गाँव में हम काम करें. रिसेंटली वी आर टाइंग अप विथ व्हील्स ग्लोबल, उनके साथ पिछले 2 महीने से बातचीत, इंटरेक्शन चल रहा है. और पर्टिकुलरली इन दिस एस्पेक्ट कि मेंस्ट्रुअल हाइजीन एंड साइकिल पे हम किस तरह से काम करें, तो वी टाइड अप विथ अमृता आनंदमयी, जो अमृता माता हैं केरला में, उनका जो NGO है उसके साथ हमारा टाइप है. उन्होंने एक सक्षम करके एक सैनिटरी नैपकिन जो रिसाइकलेबल बनाना वेस्ट के साथ बनता है, उसको क्रिएट किया है. और हमने उनको 3 स्टेट्स में हम लोग काम कर रहे हैं, महाराष्ट्र, मध्य प्रदेश और सिक्किम. और वो लगभग 350 रुपये में 6 का पैक आता है. स्पोक हब मॉडल हमने उसमें यूज़ किया है, और उसमें उनकी खास बात यह है कि इट कैन वर्क फॉर एटलीस्ट 3 years. रिसाइकलेबल है, बनाना फाइबर से, एनवायरनमेंट फ्रेंडली है, और उसकी कॉस्ट भी लगभग बहुत कम रहती है. और अभी तक लगभग केरला में उनका यूनिट है, और लगभग 5 लाख से ज़्यादा उन्होंने उसको सर्कुलेट किया है, यूज किया है, और उसके रिजल्ट भी बहुत अच्छे आए हैं. तो आगे हम अगले 3 साल में जो व्हील्स ग्लोबल और APPI के साथ मिलकर काम करने वाले हैं, उसमें 3 स्टेट हम फर्स्ट ले रहे हैं, राजस्थान, उत्तराखंड और हरियाणा. उसके बाद में फिर इसको पूरे देश भर में हम नॉर्थ ईस्ट में और बाकी राज्यों में भी यूज करेंगे। तो सूक्ष्म की खास बात यह है कि रिसाइक्लेबल है, बनाना फाइबर से है, कोई भी उसको ट्रेनिंग के बाद बना सकता है और इट विल बी ए रियली गेम चेंजिंग सिनेरियो इन सैनिटरी नैपकिन्स की आप उसको रिसाइक्लेबल मटेरियल में बना के यूज़र फ्रेंडली बना पाएँ। तो यही हमारा कहना है कि हम सब मिलके उसके लिए बहुत काम कर सकते हैं।
Thank you. And I think we are running little late with the interest of time. I would request all the panelists and guests from the Will Global to come up here for the front for the picture. And is Dr. Samadar here or?
Please switch off that light. Otherwise, we are all looking different. Can you not switch it off? Okay, we're coming forward. Now this is the background. Yeah, perfect.